Hey Gary, this is Dr. Parker, and I wanted to make a quick video overview so that when you come in to see us, you understand kind of what we're talking about, and also help. So if you see this and then you think of some questions that you might have, that you feel better in control when you're coming in to ask those questions and figure out what you want to do. So, you told us when you came in that straighter teeth was something that you would like if you could change anything about your smile. But the most important now is getting a cleaning, which you did, which is good, and then a review of your old fillings and dental work. So, when it comes to dental health, Gary, my job is to help educate you on where you're at and tell you what I would recommend, and then your job is to tell me what you want to do about it. You can do nothing, and let things be as they are. You can do a little bit of something, or you can do everything that I recommend. Whatever you want to do is up to you, and you're always in the driver's seat. So, dental health comes down to three things. It comes down to gum health, it comes down to cavities and old fillings or old restorations on the teeth. Then it comes down to balance and the function. That's function between the jaw joint and the teeth. So, you had a cleaning done, and it'd been a few years since your last one, but good report from our hygienist. And so she measured your gum health and checked around for cleansability and bleeding. And so you had some 3 and 4 millimeter pockets, and there was some bleeding in the back. So everything's within cleansable limits, but the bleeding is going to be expected when it's been a few years since your last cleaning. So the way we take care of bleeding is dealing with the bacteria. So bacteria is what causes the inflammation and the infection that leads to bleeding. So a couple of different ways that you can deal with that bacteria in your mouth, Gary, is you can have us treat it, or you can treat it, or do a combination of both of those. What I would typically recommend in this instance is a antibiotic cream to get in there and clean out the gums. Do that for a couple of weeks. Then coming for a more frequent cleaning, so coming about 3 months after the past cleaning, so that would be around March, and then going back onto the normal, recommended 6-month routine cleanings. I know probably you got some motivation from the cleaning to do better, and so we can talk more about what you want to do there and where you feel like things are at as that goes. But bleeding in the gums is inflammation and infection and not a sign of health. So that's where you're at on the gums. As far as cavities and old fillings, let's start taking a look at some of these old fillings that you have. Okay, this is a picture of the back of your upper front teeth. You've got these two old silver fillings here on the side front teeth. And you can see how these teeth are slightly misaligned here. Not too bad, but definitely some overlap and whatnot. And so I could see how straightening your smile would be something that would be nice and help things look a little bit better, be easier to keep clean. But let's talk about these fillings here. So you can see around this filling. This filling's probably been in there quite a long time. And you can see there's this line that's developed here and this kind of shadow around that old filling. That right there is some breakdown. Here's another view on the other side, a bit more in focus. You can see how there's a crack that's coming from there, and a crack that's coming from there, and some slight discoloration here. Less discoloration on this one than the other one, but definitely some signs of breakdown. Now, these front teeth aren't under a lot of stress, and so this is something that, depending on how preventive oriented you want to be, we can definitely get in there and remove this old silver filling and place a new filling in place of that. And I would assume that hopefully that would then maybe be the only time you'd ever have to fix these up. The longer that you let cracks like this develop, the more likely that this is going to become a bigger problem and not just a simple filling to replace it. So, if this were my teeth or, you were my brother, I would say, hey, look, let's switch these out, so that way we don't end up with a much bigger problem like a crown or something because of the breaks. This right here is your upper left very back tooth, and you can see there's an old silver filling on this tooth as well. But this filling has lasted quite a long time, and it looks pretty good. You can see along the edge here, there's a lot of white, there's not a lot of shadow there. But I do see a crack on the back of that tooth there, and a lot more discoloration around that. And maybe even this issue right there, that could be a cavity. So this is one that I want to take a look at in your mouth when I see you next, Gary, and so that way we can make sure things are looking okay on that. This is the tooth, I believe, yeah, right next to it. Yep, you can see the cracks there. This is one that's definitely much further along in its breakdown. You can see right along here this crack, and you can see that crack there, and a crack there, and you can see a couple cracks here. So, and it looks to me like you've even cracked this filling here. So this is one that I would definitely, based off of this photo, say probably time to fix. I believe there's another view. This is that same tooth here. You can see this intense crack going down the tooth. Cracks in teeth, Gary, are like cracks on a windshield. They continue to get worse over time. I'm sorry, this is the wrong one. And eventually cause bigger problems. And so I would recommend doing something about this tooth here at this time. But I need to take a look at the tooth to give my recommendation on what that fix would be. There's 3 fixes for teeth. You do fillings, in between you do an onlay, and then the final one is a crown. So a crown would cover up the whole tooth. A filling would be something small like this, and then an onlay would be something, like if we were to do, just the bad stuff here. So I have a feeling an onlay would probably be the recommendation for this tooth here. And we can talk more about that when you come in. This is a filling here on your lower left side, Gary. You can see the discoloration under. There's a white filling here, and very nicely done. Doesn't look too old, most likely replacing an old silver filling. But there are a couple cracks here on the back side of it, and then this discoloration here on that side. So I'm curious to how old this filling is, Gary, when you think it might have been done, and I need to see these cracks up close because there's concerns on that there. This breakdown here, this shadow right there. So, and this is a tooth behind it. Great. So this is your lower left very back tooth. This is one that I would definitely feel pretty confident recommending that you repair and fix because this dark spot here, the crack here, and the breakdown around this filling here. So there's those teeth there. This would most likely also be an onlay situation on that tooth. So looking that over, that's talking about the teeth. So you've got a few fillings that I would recommend looking to repair at this time. Some others that we need to look closely at and see, okay, what do we need to do? Is right now the time to do it, or do we wait? And we'll talk about that. So now we get to function and balance. So part of the big balance and function is this joint on both sides. So on this x-ray, we want to see that these joints look very similar. So they're nice and round here, not flat, and they're looking very similar on both sides. You got space in between the joint and the bone here. So I think stabilization of the joints there is good, and so that's good news there. We did a bite scan on you, Gary, to assess the pressure that you're putting on your teeth. So these are the front teeth here. This is the back left. This is the back right. What you'll notice is you're a little heavy on the right side. When we had you chew a bunch of times, what you'll notice is the pressure is mainly over here on the right when you start, 65% over on the right. And then as you squeeze together, things get a little bit closer. That initial contact hitting on the right is going to prematurely wear things down over time and also put some extra stress on the system. So that imbalance there is something that we should note, and something that's going to predispose you to potentially some problems down the road. So let me show you when you slide to the side, what this is supposed to look like. This is an ideal bite where things are balanced in the middle here, the initial contact's in the front, and then you slide into the center. Now as he slides to the left here, what you'll notice is that he slides up to the front teeth almost instantaneously. right up to those front teeth. What that does is that gets all the pressure off the back teeth and puts the pressure off of the jaw. That is a bite that is balanced. So let's take a look at yours here as I play it. When you slide to the side, what you'll notice is it struggles to get up to that front left spot. It takes kind of this weird turn here where you're putting a lot of the pressure on these back teeth. This is what's called an unbalanced bite, and something that is more traumatic to the teeth, which could be the reason why you have these cracks in the teeth because of the pressure that you're putting on these back teeth when you chew. Now, I don't think that you're a nighttime grinder or anything like that, but over time, chewing in this manner can lead to more dentistry, especially when you're looking at, if these are the original fillings, and then we're putting a secondary filling in or onlay. Each time we work on the tooth, the tooth gets a little bit weaker, and the foundation's not as strong, so the bite becomes more and more important as we go. Now, it's important for me to know this because when I go to fix some of these old restorations, when you're ready, when you're like, yeah, okay, Dr. Parker, I want to fix those up, then I can make their bite a bit better by knowing this information. But there's a couple different ways we can get your balance and your function better, and we can do that by straightening the teeth or making some adjustments on the teeth. And so if you've got a desire to get those teeth straighter, then through that I can get your bite ideal. And so we can talk about when or if you want to do that. And then if not, if doing some adjustments to getting the bite better is something that appeals to you to get your functional health down. So that covers the gum health, and that covers the old restorations and the balance there, Gary. So hopefully you can check this out before you come in, and hopefully it's helpful for you. Thanks.